Autism is often talked about, but rarely understood by those who have not had direct experience with it. Autism, also referred to as Autism Spectrum Disorder, or ASD, refers to a broad range of characteristics or symptoms that vary in their impact on the individual's interactions with the world around them. Because it refers to such a broad spectrum of traits, it's difficult to provide a specific definition of the condition. Individuals with autism may or may not experience co-occurring disabilities, such as cognitive impairment, language delay, or extreme anxiety. This makes it even more difficult to determine if an individual actually has autism. Typically, an individual with autism interacts with others in a way that is different from his peers. Some prefer not to interact with others when possible, others struggle with social communication, and still others simply find interacting with others hard. Individuals with autism can and do make friendships. This can range from a single close friend who shares a similar preference for minimal interaction to a group of friends who are easy for the individual to be around. Most individuals with autism have a preference for sameness, at least in some areas of their lives. They may prefer to watch the same TV shows or movies or parts of them repeatedly. An individual with autism may struggle with changes to their daily routine or need complete activities in a specific order. Some individuals with autism engage in more apparent stereotypic behavior, such as rocking or hand flapping, than their peers. Others hyper-focus on a specific interest, such as trains, clocks, or My Little Pony. Other individuals with autism may focus on parts of items such as wheels, gears, or pipes. These interests often become so intense that they overshadow the individual's interests in other topics. Identifying autism early in life can help parents and caregivers learn what they need to know to help their child thrive. While every individual with autism expresses symptomology differently, early identification of the condition leads to significantly improved outcomes for children who experience serious deficits. Many children can be diagnosed as early as 18 months. However, a diagnosis around the age of 3 is more common. Often a child is referred for evaluation due to concerns expressed once a child enters the public school system. Anyone who has concerns about the presence of autism symptoms can make a referral for evaluation. Often teachers identify that the child is off track developmentally because they are able to easily compare one child's development with that of other children the same age. It can be difficult for parents to recognize missed developmental milestones, especially in their first child. Often pediatricians miss early warning signs for a variety of reasons. A pediatrician may not have a lot of experience with autism, and he only spends a few minutes with the child 1 to 2 times per year and relies heavily on the parent's report of concerns. However, if the parent doesn't know what signs they should be concerned with, they can't relay that to the pediatrician.